Good afternoon, everyone. Great to be here. So my name's Kieran Keane. I'm a program officer here at WorkSafe Victoria. Very fortunate to be working in the WorkWell team. So just quickly about me, I have a background in public health, particularly in the mental health space, and I've had the privilege of working at some really great organisations like WorkSafe Victoria, where I can help others make change. But before I begin, I'd like to quickly acknowledge the traditional custodians of this land, of where we work, live and play. And we pay respects to our elders, past, present and emerging, and to elders and members of other communities who might be watching today. So to get us started, I want to thank you personally for joining me for, this afternoon for what will be a very quick, but hopefully very informative session on workplace mental health. So I'll briefly cover on where employees should be directing their efforts, and then touch on what the WorkWell program is doing and how we're supporting Victorian workplaces do this. I do know we are limited with time today, so if you did have any questions throughout the preso, please add them to the Q&A section and then use the discussion forum for your chat. So they should be the little drop-down menus on your right-hand side. So not in your Zoom chat, but in the discussion forum. Unfortunately, due to the time constraints, I won't be able to answer those questions on live, but what I will promise is I'll make sure we record those questions and we'll do some follow-up and follow up with some correct answers. So to kick us off, the big question. So where should employers and workplaces be directing their time, money and efforts? So now we understand that employers are finding workplace mental health and mental injury really challenging, and it can actually be really hard to navigate. But the research is telling us that the workers exposed to these 11 factors on your screen are more likely to experience work-related stress. So now if this stress is prolonged, it's ongoing and it's can be severe, it can lead to both psychological injury and also physical injury. So the two are not mutually exclusive from each other and often cross over. But what we're seeing in this green bubble here is probably not going to surprise you. So things like low job control, we're talking about poor support, low role clarity and poor workplace relationships, which covers the issue of workplace bullying. And we refer to these topics as work-related factors. Now, these work-related factors are actually the root cause of workplace mental injury. But most importantly, these are the things that employers and workplace and leaders like yourselves can control. And there's actually some really great content that we've recently published on the WorkSafe website that covers all these work-related factors and provides some really tangible examples. But more importantly, as an employer or leader in your workplace, it's your responsibility to start thinking about these hazards in the same way that you do currently in regards to physical hazards. And if you make these factors made a priority, you can create positive mental health, positive mentally healthy workplaces. So in this next slide, we're looking at preventing and promoting mental health. So when we think about a physical hazard in the workplace, what do we know? We know that prevention is key. So our aim is to eliminate or reduce these hazards, and this refers to the hierarchy of controls. But what we need to do now is start to switch our thinking, and we take that same approach to preventing those psychosocial hazards. So what we do know is that many employers have implemented a range of really great programs at improving the mental health of workers, which is fantastic. But traditionally, these have been focused on those secondary and tertiary approaches. So if you look at the right-hand side of the screen here, you can see the tertiary column. And this is all about managing work-related stress and work-related mental injury once it's already present. So once it's already occurred. And for an example of this, we're talking about like an EAP program that uses counselling services, or maybe you're returning people back to work after a work-related mental injury. As we shift into the middle there, we've got the secondary column. So this is where we're focusing our efforts on giving the workers the knowledge to support and to cope with the stressful working conditions. And this brings up things like resilience training and mental health first aid training. So what we do know is that tertiary and secondary approaches are absolutely needed and are critical, but wouldn't it be better to start working in that primary space? So preventing the stress in the first place. So like I mentioned earlier with the physical injury, we want to work in that preventing mental injury space. But what does a primary approach actually mean? So when we're talking about primary prevention, it's about designing the environment and the systems of work to keep people mentally safe. So our aim is to remove or reduce any of those work-related factors that we saw in the last slide before the harm is caused. So for an example of this, we're providing your employees with appropriate control and flexibility over how they do their work, and designing jobs and providing safe workloads. So the main key message from this slide is for positive change to occur, you must target the sources of those work-related stress, so those 11 work-related factors from the previous slide, before the psychological harm is caused. And this is going to be the best way you can support your employees and your workplace. So moving into what is WorkSafe Victoria doing to help workplaces do this. So here at WorkSafe, we're taking a proactive approach to educate and empower employers and leaders like yourselves watching today to give you the right information. So WorkSafe, in partnership with the Department of Health and Human Services, we've developed the WorkWell program. So we're a $50 million program over 5 years, so a really big investment. And we're encouraging workplaces to, number one, prevent mental injury from occurring, and also promote the good, positive mental health. And we do this through 3 major streams of work, which you can see on the screen here. So the first 2, which are the learning networks and the mental health improvement funds, and they do this by focusing on the vulnerable working populations of Victoria, which are young workers, aging workers, frontline workers, and workers working in industries in transition. Whilst on the right-hand side there, we've got the toolkit, and the toolkit is what we call a universal tool. It's free and it's online, and it's supporting all Victorian workplaces. At the bottom of the screen, you can also see leadership, and leadership is underpinning all the stuff that WorkWell is doing. So we know that leadership is key, and those people in leadership positions are the ones who are going to be able to drive that systematic and organisational change. So briefly touching on the learning networks, it's about bringing workplaces and experts together to share ideas and knowledge, and it's providing advice and support so employees can go out there and implement some initiatives for those vulnerable working populations. As you can see on the screen, we have 6 organisations that have been successful in receiving funding to be a learning network chair. On the left is the organisations, but probably on the right-hand side is the most important part, and that's the vulnerable working populations each chair is focusing on. So for more information on the learning networks, please head to the WorkWell website and you can find out all about it. Moving into the WorkWell Mental Health Improvement Fund. So the funds are providing some high value investment to projects that can create long-term and sustainable industry-wide change. So like the learning networks before, they are underpinned by 6 funding principles, which we can see on the left-hand side of the screen. Overall, we're really excited to say that 25 projects have been funded over 3 rounds of funding, and these projects have been co-designed initiatives. And what we mean by that is that in partnership with the key partners and the workplaces, and it's all about focusing on those work-related factors. So the findings from these projects will build or continue to build on the evidence base on how we can create a mentally healthy workplace. So to find out what some of these projects are doing, head to the website, and we've made some really engaging videos too, which can give you a bit of a summary of what's happening there. Finally, we have the WorkWell Toolkit. So the Toolkit is a free online tool, and it's providing a step-by-step approach to help employers to prevent mental injury and promote positive mental health. And how we're doing this is providing access to tailored tools and information that is specific to your business size, so really practical and relevant. And within these steps, you'll find you'll find information and action and tools that can address all those work-related factors, plus so much more. And within these actions, we actually contain resources such as, case studies, real stories, policy examples, videos, tip sheets, and templates. So really engaging and practical stuff. But like all of the WorkWell, the toolkit's aimed at that employer level. So those people in those leadership positions who can make that organisational change. So when we're looking at a small business, we're probably looking at the business owner who wears multiple hats and does many jobs. As we move into your medium and your larger size workplaces, we're starting to focus here on the senior management, HR, OH&S, and even health and wellbeing if you've got them. To show you what the toolkit looks like though, we've actually got a really short video to give you an idea on how it works.
Meet WorkSafe's WorkWell Toolkit, a tailored free online resource helping employers to create mentally healthy workplaces. Sign up and explore your custom dashboard with case studies, videos, and other useful resources that you can begin to action straight away with your team. Use a step-by-step approach and track each action. Then share the progress with your colleagues. The topics include role clarity, leadership, change management, and so many more. Creating a safe and mentally healthy workplace is good for your employees and your business. Discover the WorkWell Toolkit today.
So that officially wraps up the short but hopefully informative session. Mindful of time, so please head to the website and you can find out some more information about the WorkWell program. Thank you.